All right, I guess this thing is on. Welcome, friends, family, community leaders, healthcare professionals, the people, to Know Your Status, Symptoms, Diagnosis, and Testing for COVID-19 and the Flu. I'm your lifestyle specialist, Kenny Burns, host of V103's The Kenny Burns Show. This is number 5 of a series of 8 candid COVID convos brought to you by Alive and in Color. Before I go any further, I'd like to personally thank the Fulton County Board of Health, the BLK+Cross, the Gathering Spot, and of course the People Station V103 for partnering with us and lending their platforms to this important cause. The purpose of tonight's conversation is to provide a trusted space for our community to engage experts for a better understanding of the realities of COVID-19 and its impacts on communities of color. Know Your Status will walk you through the ins and outs of COVID-19 and flu testing, and will address topics such as COVID-19 and asymptomatic transmission, COVID versus the flu, symptoms and diagnosis beyond the dry cough and fever, presentation of symptoms in the elderly and the young, testing 101, why, when, where, and how, and what to expect. Once again, welcome. We appreciate and value your time. Now let's introduce you guys to the amazing roundtable of panelists. I'm going to have them chime in on what it is they do to contribute to our community in under 1 minute each. Dr. Alexis Calloway, you are up first, my love. Can you please tell the community about yourself?
Hi, good evening, everyone. Pleasure to be here. Thank you for having me. My name's Alexis Calloway. I'm an Atlanta native. I'm a practicing gastroenterologist at Digestive Healthcare of Georgia, out of the Piedmont, Atlanta location, although we have several. I graduated from Xavier University pre-Katrina, and came back home to Morehouse School of Medicine for my training. Did my residency and chief year at UNC, North Carolina in Chapel Hill. And I did my fellowship at Vanderbilt before coming back for a couple of years, and active in the community, social and medical otherwise. Good to be here.
She is educated, ladies and gentlemen. Dr. Frank K. Jones, welcome.
Thank you. Thank you also for having us here. I'm originally from Augusta, Georgia. I did my undergrad at Morehouse College, went to medical school at Morehouse School of Medicine. I am a general surgeon, a trauma surgeon, and a surgical intensivist or surgical critical care. And I did my training in surgery at Howard University in DC and a fellowship in trauma at University of Maryland. I also have my master's in public health from University of North Carolina, Chapel Hill. And I currently am adjunct faculty at Morehouse, adjunct faculty at Philadelphia College of Osteopathic Medicine, the Georgia campus. And I'm also a wound care surgeon for Piedmont Fayette. And I am also the president of the Atlanta Medical Association, which represents Black doctors in the metropolitan Atlanta area.
Yes, I'm going to rethink my career. Lisa Gooden, welcome, my love.
Thank you. I'm Lisa Gooden. I am with the Fulton County Board of Health, which is our local health department. We are located in Fulton County, Georgia, obviously serving the residents in Fulton County. I am the Director for Community Health Services and Community Health Partnerships. And basically that includes health promotion, maternal child health, WIC, and then also our stakeholder building and agency partnership building with communities and others to help us impact public health. And I've been a public health professional my entire career. And so I'm really excited to be here to share what I know we can do to help stop the spread of COVID.
We got, y'all. Let's jump into the discussion. Just a couple of ground rules I'd like to lay. Panelists, I ask that you keep all responses concise and respect each other by allowing everyone to answer the question before chiming in. Whenever you want to chime in, just signal by raising your hand and I'll make a note. We're going to start with the facts. Before we jump into the fundamentals of testing, let's do a quick recap of some of the facts around the state of the virus and its impact on our community. Don't be fooled by the silent enemy. I know you see everybody out in these clubs. They're not being tested. Fulton County continues to have the highest COVID-19 infection rates. Up to 40% of the people who have COVID-19 are estimated to be asymptomatic. that means they could be walking around like everything's cool, but because they don't have the symptoms, when in fact they are highly contagious. Fulton County is leading Georgia in county case rates at 33,340 cumulative cases of the 2019 novel coronavirus, with as much as 24% of those cases being asymptomatic. There were more new cases of COVID-19 in Fulton County in the past 2 weeks than the previous 2 weeks. Georgia is nearing 411,000 cases and over 8,700 deaths. Positivity rates continue to creep up. As of November 13th, the positivity rate is 5% compared to what it was 1 month ago on 10/13 at 3.5%. Dr. Jones, I like to pause here and ask you about positivity rates. What does 9.3% positivity rate mean? And at what percent should we be alarmed?
Right. So it's really looking, just as it says, at a percentage of the number of people that get tested, how many of them are actually positive for the disease. Of course, we'd like for that to be zero, but a good positivity rate, we say it's less than about 5%, somewhere between 3 and 5%. And right now, if you look at the positivity rates around the country, they're just exploding. For instance, in South Dakota, their positivity rate is around 53%.
Wow.
So that means out of 100 people being tested, 53 of them are positive. And there's just no way to contain the disease when you have high positivity rates.
Wow.
And so we're trying to flatten that as much as possible.
So it seems that by all accounts, we are still in a state of red alert. So let's dive in and arm ourselves with the knowledge on the ins and outs of diagnosis and testing for COVID-19 and the flu, why testing and contact tracing is so important. When I think about testing, I can't help but think about our fearless leader, Donald Dump. And I said dump, and I meant it. I wish I had Sturgis so he could play the fart noise. But yeah, more cases because of more testing. Stop testing. Miss Gooden, Fulton County has invested a lot of resources into testing. Tell us why testing and contract tracing are so important and what Fulton County is doing to make sure people get tested.
Thank you. So we have testing sites all across the county. We have about 4 standalone, what we call brick and mortar testing sites that you can go to pretty much 6 days a week to be tested. And then we have also our mobile units that are going out into our communities where the disease is most prominent. And we use data-driven metrics to be able to determine where we will send our mobile units out. And also we take into consideration those communities that may not have the ability to get to one of the regular testing sites. So we are making testing widely available for anyone who needs to have testing. So that's first of all. But the importance of testing is you really need to know your COVID status. You can walk around and have COVID and not know it and affect all of those folks around you. So we talk a lot about the vulnerable populations who you take this disease back to your grandmothers, to folks who have chronic diseases, and they're hit more hard with COVID. So it's really important that you know your status so you can alert someone about their potential risk. As well, it helps us as government and public health officials determine where the disease really is so that we can concentrate on reaching out in that community to try to slow the spread down.
Got it. With the help of CORE, Fulton County has greatly expanded testing capacity and reduced wait time for results to an average of 1 or 2 days. Testing is available for free through CORE Fulton County and the Department of Public Health. No insurance or ID needed. Testing is available to anyone. I want to talk about when to get tested for COVID. From what I understand, a recent study conducted by the BLK+Cross and Fulton County found the majority of Black respondents had not been tested for COVID-19, and the reason they gave was that they didn't feel sick enough. Dr. Jones, why is this cause for concern?
Well, this is really what's hurting us with getting control of this disease, is that it's the asymptomatic, meaning you don't have symptoms, carriers. People feel fine, if don't feel sick at all. And so they feel like they can go out. They don't need to wear a mask. They don't need to social distance. But those are the people, particularly in the age groups between 18 and 25, who are hanging out, going to clubs, going to parties, that are spreading the disease. And so really everyone needs to be tested. You ask who should be tested? Everybody should be tested. And we should be tested several times, not just one time. If we could have everyone tested and get our results back in a relatively short time, then you could quarantine or isolate those people that needed to be quarantined, and the rest of us could practice the social distancing. And so it's very important that we test as many people as possible. The other part of that is that we need to be tested because then we need to do what's called the contact tracing. So that if you're positive, we need to know the people that you've been around over the last several days. So again, it's very important, again, that everybody be tested and that we get results back in a relatively short period of time. And we'll probably get into that a little bit more. But that's the most important thing, and to capture those people that are the asymptomatic carriers.
All right, now to one of your students. Dr. Calloway, when I think about COVID symptoms, I think fever, dry cough, shortness of breath, but what else should I be looking out for?
Sure, absolutely. That's a great question. I think that there's kind of a misnomer at first that this was just like a typical respiratory virus. And we thought that, of course, because that's how it's transmitted mainly. But the issue is that about a quarter, 22, 24% of people, and sometimes 16% alone present with just GI symptoms, or GI symptoms as one of the harboring kind of first initial presentations of COVID. So having a change in your stool habits to diarrhea, or having onset of nausea and vomiting that's new, or having generalized fatigue or cognitive kind of issues that are different, you may not realize that those symptoms could potentially be a warning sign that you could have COVID. On top of that, we're seeing this kind of loss of smell and taste that we found more about this summer that may be a cause. And of course, with allergy season and things like that, it's easy to dismiss a lot of these symptoms because they're vague. But it's important that if something is different, especially if you've been in an environment where you think that you might have been at risk for exposure, it's important to alert your doctor, to let someone know, to go to the health department to get tested, because you could potentially spread during that phase where you're infectious and don't really know yet.
Right. And Dr. Calloway, I had some of those questions next, but you answered some, so I want to ask you another one.
Sure.
It sounds freaky, like it freaks us out. It's a whole lot going on. The symptoms are sporadic. You don't know. I mean, you think it's, it's loss of smell. You think these things, but then we were talking about asymptomatic. How do you make one feel comfortable and know that that this needs to be a part of our routines? Because going forward, this has to be a part of our routine.
Yeah, I think the beauty of the pandemic is that we've all become very well versed in virtual platforms. And so there are telemedicine appointments, there's minute clinics, the access with the standalone, the brick and mortar COVID testing sites and the mobile testing sites, and then lots of community organizations reaching out, making health fairs, making it available to you. Don't fear the disease. Fear what happens if you don't act. That's the important thing. Because it doesn't mean you're going to be necessarily so sick that you end up in the hospital, but it's good to know if you have it in case you're around your grandma, because she might.
Mm-hmm.
Amen. Now I'd like to take a pause and see if we have any questions from the audience before we move on to the next section of questions. Any questions out there? Hopefully there's someone assisting, because I can see no hands waving at the gathering spot. No questions? Y'all scared like me? Okay, bet. On to the next one. Types of tests and what to expect when getting tested. Getting back to testing, ladies and gentlemen, another thing that the study from the Fulton County and BLK+Cross found was that many people really question the accuracy of COVID testing. And from what I understand, not all tests are created equal. Dr. Jones, can you help us understand the different types of testing available and their relative accuracy?
Yeah, I think this is one of the things that causes a lot of our people not to get tested because of the fear of getting tested. I mean, there are lots of different types of tests that give you different types of information. But let's talk about the most common test right now when you're looking for the actual parts of the virus itself.
Right.
And that can tell you whether or not you have an active infection going on right now. Most of those are done by either a nasal swab or a pharyngeal swab, and sometimes it's uncomfortable. So I think that also leads to people not wanting to get tested because it can be uncomfortable. Um, and then there are other tests where we're trying to see whether or not you develop antibodies. So antibodies form to help kill the virus, but you may get that after you've already had the virus. So that's only helpful if you're trying to find out, have I been exposed to it in the past? And there are different types of antibodies that can kind of give you an idea of how long it's been. But certainly we need to know, it's better to know if you actually have this. And so one of the problems with the testing is that it takes so long to get a result back. And when we were in the last surge, some people, it took 7 to 10 to 14 days. And so it doesn't help you if you get the test, but you don't get the results back for 14 days.
Because you're cured.
And so there's a lot of work.
In 14 days, right, Doc?
Basically, you are. So now they're doing a lot. And I just heard today that they're finally coming up with like an at-home test where you can do your own swabbing. It takes 30 minutes to get a result. And that would be very helpful because then in the safety and comfort of your home, you could do your own test and find out if you're positive or not. And so this is something, and this is where I really fault the administration for not developing these kind of tests a long time ago. We should have been able to do this months and months ago, and we would have been a lot further along in getting out of this disease.
Yeah, well, Donald Trump lost the election, and we have a Biden-Harris presidency on the way. Doc, one more question for you. What happens after I get tested? Am I free and clear? Can I get it again? Talk to us.
It depends. Let me answer the last question first. Can you get it again? We don't know. We don't know. There have been a few isolated cases of people developing the disease again. And so do you develop immunity? Yes, you develop some immunity, but how long does it last? We don't know. So there is a chance that you could catch it again. But again, that's a slight chance right now. At least that's what most researchers think.
Got it.
Once you get your test, you still need to act like you have the test because you may not get your results for a while. So you still need to practice the social distancing. You still need to wear your mask. You still need to wash your hands. You still need to stay away from certain high-risk family members. And so once you get your test, and let's say you're positive. So if you're positive, then you still need to wait 10 days from after the time that you took your test before you go out and about in the community again. You still need to wear your mask when you go out again. If you get your test and you're negative, you still need to practice, do all those things you talked about with practicing the public health measures that we know protect you from the disease. So regardless of if you're positive or negative, you still need to do things to protect yourself and to protect others.
Absolutely. It's really about everyone else. Ms. Gooden, what type of testing does the county provide? And can you give our listeners any assurance on the accuracy of those tests?
Sure. So we provide what we call a nasal swab test. That is considered one of the gold standards, PCR test. And basically, as Dr. Jones mentioned a little bit earlier, it has a fairly high accuracy in being able to detect the COVID virus. So none of the tests are 100%. And so sometimes even with what you consider to be the gold standard test, sometimes there are false positives that happen, and depending on the times that people are tested, it may not show up. So it's really important to do the things that he has just told us to do when you get a test and while you're waiting on those results. And we have an average now of about 24 to 48 hours in Fulton County, and that's been consistently going on now for at least the last 4 months or so. I know over the summertime, we did have a huge backlog, but we've been able to work through that. And so now you typically can get your results back within about 24 and 48 hours. But our test is exclusively the nasal swab test.
Got it. And I'm actually a father of 2, and they're doing spit tests on the collegiate level as well. So I've heard of that. But it's almost flu season, y'all. And how I know is because I went to the doctor to get my annual physical, and they tried to put that flu shot on me. Dr. Calloway, and I never take the flu shot, but you experts can take me away from those conspiracy theories and make me an informationist. Dr. Calloway, help us understand why getting the flu shot is so important and who needs to get one.
So if there's any year to consider getting the flu shot, this would be the one. There's a
Why,
good
Miss Calloway? I need facts. I don't mean to cut you off, but I am confused. Look at my eyes. I am confused when it comes to the flu shot.
And that's a good question to have. But one thing we do know is that having influenza virus with the possibility of COVID on top of that could be seriously detrimental to your health. Okay. And at this point, everyone's holding out hope, supposedly, for the vaccine for COVID. So why would you not take advantage of the opportunity to give yourself some level of protection against whatever the virus may be? So, because it's still going to be flu season either way. And you don't want to be in the hospital or in the emergency room or in urgent care with people who possibly do have COVID. So you're actually not only protecting yourself from the flu, but you're also likely decreasing some of that population interaction with COVID because you don't need to seek emergent care later. Also, the flu shot is very, very safe. It's recommended for just about everyone except for small infants and people who are like on active, and there's like the dead version of the virus that we give in a vaccine. We don't give the live vaccine to certain people. Like, there's lots of different ways to get it. It's been studied. It has very low side effect profiles unless you have known allergies to like the actual injection itself or a history of things like Guillain-Barré, which is like an acute demyelinating or kind of destroying nerve disease syndrome. But we know for a fact that the flu shot does help to reduce morbidity and mortality. So if you could do anything to help out your neighbors and yourself, this would be the year to get your flu shot.
I'm playing, but I'm not playing. I just feel like if people had better hygiene, we wouldn't be in this. But I'm going to stay with you, Dr. Calloway. So it sounds like just about everyone should be getting tested and getting a flu shot, right? You're saying that?
Correct.
But it doesn't matter which one first.
Well, in terms of getting tested, you want to know if you're positive, obviously, like Dr. Jones said earlier, because you shouldn't be walking around in, general population exposing yourself. And of course, there have been a few studies that are coming out there. They think that there's maybe a little bit of cross protection from having influenza. But I think that, like you said, we should be testing frequently. We should be testing often. We should be testing anytime we have exposures that are of concern. So, it's kind of almost like a simultaneous thing. Most people, though, right now, we're getting the flu shot towards the, later fall season. So October is your prime month, November, especially now, especially those who are more vulnerable, like the immunocompromised and elderly. So this is the window, especially if, people are planning maybe a small gathering or not, which I don't necessarily endorse, to be around family. You should be getting yourself as protected as possible.
Got it. So let's talk about COVID versus the flu. There's been a lot of controversy over COVID versus the flu. At the beginning of the pandemic, many people were saying that COVID-19 is just like the flu. If we look at the death rates alone, that seems to be untrue. But what else should we know about the difference between the two? And Dr. Jones, can you enlighten us on some of the differences and why it matters?
Yeah. Well, the first thing, the similarities that they both are viruses. And so that's probably why there is a lot of confusion, because you hear it's a virus, they must be the same. And some of the symptoms are the same. I mean, you have, the upper respiratory tract symptoms, the malaise, the nausea, the vomiting. Those are all things that seem similar. The problem with COVID-19 is that it's much more contagious and much more deadly. And so that's why it's important to be able to separate the two. With the flu and also with COVID, most people, if you're not in the high-risk categories, are going to have mild symptoms. You're going to feel bad for a few days, and that's it. The other thing about the flu is that we don't really know of any long-term effects from having the flu. Once you're over with the flu, you're usually done. Whereas we're starting to see with COVID-19, there are some long-term effects that we don't even know about, but we're looking at things like how it affects the heart. People can develop a cardiomyopathy, how it affects the nervous system. One of the things about the flu, about COVID that we just learned, well, not just learned about, but we learned pretty late in the disease is blood clots. And so you're getting these blood clots associated with COVID. And that's what was leading to a lot of the deaths.
Wow.
And so now, one of the reasons why people are living longer is because they're anticoagulating them or giving them things to help the blood thinner so that they won't get the clots. People come in and drop dead suddenly, and you didn't know what it was. And it was a part of COVID. And so people with heart attacks, with pulmonary embolism. And so that's just the way we treat it. There's some of the medications that we use that we would use during COVID that you wouldn't use during the flu. For instance, steroids have been found to be useful in COVID. You wouldn't want to use steroids during the flu. So there's a practical reason. And just kind of a funny, not really a funny reason, but I mean, I'm sure many of us have experienced having a cough during this time. You see how people look at you. If you start coughing now, everybody thinks you got COVID. You know?
I'm ready to kick family members out, Doc. Don't sneak. Don't get away.
Yeah. So you don't want to be somewhere and coughing, you know, and people thinking, you know, you got COVID, and actually you just have a upper respiratory tract infection or the flu or something. So that's a minor reason. Yeah. But there are some similarities.
There's a lot of mental frustration going on. I mean, like my son plays for Kennesaw State, and they're in a bubble of sorts, getting ready for basketball season, and he sneezed and coughed and had to take a test when they already take 3 tests already, and then was proven to be negative. But Dr. Calloway, what else should we know about COVID versus the flu?
So, I think Dr. Jones touched on a lot of the really big ones. And I think something that we're finding that particularly impacts people who look like us is the comorbidities that make you more vulnerable for severe outcomes from COVID. So they found that it's been in generally middle-aged, men, obese, diabetes, high blood pressure. And I don't know about you, but that sounds a lot like a lot of the people I know who look like me and live around my parents and around me. So when we're thinking about COVID and knowing, I mean, for the most part, like, yes, generally for like the younger population, things like that, mild symptoms, you'll do fine. It's been found that children have tended to do worse with influenza virus than with COVID. But at the end of the day, we don't live in these bubbles of just like you're only around people exactly your age. We're in multi-generational households and things like that. And so that's the reason why it's so important to take the testing seriously, the contact tracing seriously, and to understand that there's still a lot of evolving knowledge that's coming about COVID because it's new. So don't take those risks. And like the clot thing, it's serious. I've seen it. On the consultation service as a GI doctor, we got called about bleeds and all kinds of things. We've seen people lose limbs to these clots. We've seen lots of things that are very, very, very different than what you would expect with a typical influenza respiratory severe illness.
This is why we're doing the Know Your Status diagnosis and testing for COVID-19 and the flu, ladies and gentlemen, because prior to these professionals saying the professional thing, in my mind, I just like, I'm not doing the flu shot. I don't want it. I don't need it. I don't be getting sick like that. But you guys are I'm on the fence now. I don't know. But Ms. Gooden, can you bring us home and tell the community where and how to get the flu shot?
For sure. So for those individuals who have health insurance, you can go to pretty much any drugstore, retail store, and definitely your doctor or medical provider to get a flu shot. The Fulton County Board of Health is providing free flu shots for those individuals who do not have insurance. And what you would need to do is you can call our office, or you can actually register on the website where we have our COVID link, and you can register to get a flu shot. We're offering these flu shots through our COVID testing sites, and as well through our mobile COVID testing sites. We also are doing this in partnership with CORE. We mentioned CORE earlier, and CORE helps us to expand our reach throughout Fulton County. And so we have a number of mobile units that are operated through CORE, and we will offer those flu vaccines through the mobile units as well that are operated by CORE.
Got it. And I'd like to try to open up the floor for some questions. Do we have any questions? I feel like I'm supposed to be clicking some link or something to see the hands, but so am I? No, don't say that. Alexis, did you say Am
No, I didn't.
Is
But
it my fault?
No, I think there's just a question maybe in the chat about long haulers.
Do you see it?
It's in the chat.
I don't see it. Come on, if you see it, Dr. Calloway, help me.
Well, I'll help you out here. So
Thank
it looks
you.
like there was a question posted in the chat about long haulers. And for people who are not familiar with that is, those are the folks who have technically recovered from the acute COVID viral illness, but have symptoms, which can be a myriad of things that persist for weeks, months. We don't really know at this point how long they are. They are starting to do some cohort type studies to figure out like what are the maybe reasons that people are more inclined to have it. They have seen that a lot of the cognitive fatigue, shortness of breath, desaturation, oxygen levels with exercise are some of the more persistent symptoms that they're seeing. And it's hard to tell if it's truly due to the virus or the deconditioning from it itself or the systemic inflammatory response. They're not really sure. But, there's just not a lot of data yet because we don't have a lot of people who've had the virus. It's, really only been something here for the past year, to be fair. So a lot of patients and, even providers are reaching out on virtual platforms using things like Facebook and Twitter to kind of, get ideas and perspectives about it because we don't truly have an idea of like what the symptoms are that make you more inclined to be a long hauler, how long you'll have it, and what is your actual like chance of recovery. The loss of smell and taste, however, is one that they're finding does recover slowly over time. But it's much, much, much slower than what like a basic sinus infection or, the cold or anything like that.
Awesome. Dr. Calloway, do you see any more questions in the chat?
I do not.
Okay, great. Ladies and gentlemen, that wraps up this week's Know Your Status, Diagnosis, and Testing for COVID-19 and the Flu. Next week, Tuesday, November 24th at 7 p.m., join Alive and in Color for treating COVID. Know your options. Visit aliveandincolor.com for the latest information on COVID convos and how to beat COVID-19 with the truth. My name is Kenny Burns on behalf of Dr. Frank Jones, Dr. Alexis Calloway, and Lisa Gooden. We appreciate your time for getting the COVID facts.
Thanks for having us.
Thank you.